Did you know that pet therapy in hospitals helps patients get better faster? Bringing live pets to the bedside has been shown to lower blood pressure, reduce anxiety, and boost the moods of patients and staff alike. On this week's Health Talk, we'll discuss one of my favorite topics, pet therapy. Our guests are Gayle McGrath. She's the assistant to the president of Norwalk Hospital. Her pet therapy dog, Timbo. And Amy Lionheart. She's manager of volunteer services and a member of the patient experience team at Nuvance Health. So stay tuned. An uplifting Health Talk is up next. Hello, I'm Dr. Eric Mazer. On this week's Health Talk, we were discussing a really fun topic, pet therapy. Our guests are Gayle McGrath. She's the assistant to the president of Norwalk Hospital. Her pet therapy dog, Timbo, and Amy Lionheart, manager of volunteer services and a member of the patient experience team at Nuvance Health. Welcome to Health Talk. It's so good to have you both. First time for everybody.
Thank you for having us.
Oh, it's a pleasure. I think, first of all, everybody's got to be Timbo. So tell us, Gayle, tell us about Timbo. He's your pet. He's a real pet, right?
Timbo is my pet. He's 4 years old. He's an English cream golden retriever. Got him at 9 weeks, and I knew the goal was going to be pet therapy.
So, yeah, of course, we've known each other for 20, 30 years, forever, and so you know a lot about the hospital. And so you actually got him with the idea of him being a pet therapy
Yeah, that
dog?
was the purpose. So I started training Timbo at 9 weeks of age, basic obedience, and I still continue that basic obedience every day so we don't lose the training. But Timbo,
well, I can tell you he's already better behaved than my 6-year-old grandsons.
And he's had several thousand hours of training.
Well, I do want to get into that. And Timbo, at the end of the day, you take him home, he's your pet?
at the end of the day, Timbo is my pet. You know,
How does he act when you get sick?
when I get sick, well, he looks at me with those big brown eyes for
And
sure.
you feel better.
And I feel better.
Well, I want to give Amy a chance to say, what's pet therapy? Tell us a little bit about it. We've done shows on this in the past, and now it's part of the whole network. Tell us a little bit about it.
Well, it's interesting that you should ask. Volunteers come in all shapes and sizes. We have volunteers that come to our organization with warm noses and fluffy tails. And these volunteers are part of our Canines for Caring program. The Canines for Caring program is an animal-assisted activities program where the animals come in and they, throughout the pandemic, have visited with staff to really help to try to reduce anxiety. Throughout this nation, we're dealing in healthcare with a turnover crisis. We have staff who have been incredibly stressed out.
So let me just stop you, just because this is something I wasn't aware of. I always have thought of pet therapy as really mostly for the patients, and you're talking about for staff. So this is really a new and important role for Timbo and
Absolutely.
his friends.
So the animals that come to us are highly trained. Gayle is a handler. Not only is she an owner, but she's a handler. We call in pet therapy, in the pet therapy world, we call her a handler. And so they together are an animal activities team.
We really are a team. It has to be a team. I could not do it without Timbo. Timbo could not do it without me. We work together as a team. It's very, very important to be clear about that.
We recently went to visit the emergency department staff, and when the staff came out, it was so heartwarming. I had someone tell us that, you know, it was a chaotic situation. The emergency room was flowing with patients, and when the staff came out, even for just 5 minutes, they instantly had a few moments of calm and quiet to be with Timbo and really kind of de-stress. And it instantly added smiles, and it changed their day.
They didn't want to let go of Timbo.
They didn't.
They did not want to let go of him. The hugs, the petting, it's just so impactful.
That's a wonderful, warm heartwarming story. Particularly, we hear that the EDs in this middle of the pandemic have been such high stress, unpleasant places to work. They're doing a life-saving job, but obviously very difficult to work there.
Well, if I may share, research studies have shown, there have been studies conducted by the Mayo Clinic as well as American Heart Association and several other organizations. And what it tells us is that not only does animal-assisted activities help to produce endorphins in people, and we all know that endorphins make people happy.
Endorphins are good.
Right? Endorphins are good.
And you don't have to run 26 miles.
It also decreases cortisol levels.
That's a stress hormone.
You mentioned earlier blood pressure, and it also helps to prevent burnout among staff, and really helps to brighten their day.
How about the patient side of things? As I said, I know that animals have been used to help some of the chronically ill patients in the hospital. COVID put a damper on that, literally. But
it sure did.
Are we getting back to that now?
So we are actively recruiting animal teams, therapy dog teams, because we're in the process of bringing them back to the bedside. And we piloted a program recently where we went in and there was a woman who was dealing with some pretty serious issues, and her diagnosis was bleak. And she requested an animal to come in. Well, when I tell you, the moment we walked into that room.
Was that you, Gayle? Were you part of that, or is it somebody else?
No, it was another person I graduated with, another golden.
Because I want to get back to yours.
The tears of joy started flowing, and this individual said, "This is just what the doctor ordered." She was so pleased, and she asked to please bring them back whenever we could. Please have them come back because it really changed her outlook.
This is not a drug. It's not an expensive piece of technology. It's just the contact with a warm hue. So, Gayle, you've had patient visits, haven't you?
It is the contact. But before I go to patient visits, I just want to mention that one experience I had with Timbo when walking down the hall. An employee came up to Timbo, and he bent down and he thanked Timbo. He said, "Thank you for what you do for our patients and our staff." And that's what it's about. Timbo only is himself. There's no strings attached to what he provides in pet therapy, but he gives so much of it just by being who he is. And that's why I want to do pet therapy.
The human-animal bond is really powerful. We have to, when we treat patients, we have to think about the whole body, mind, soul connection. And it really is powerful when you see an animal. It doesn't even have to be a dog. If you're at home and you have a cat or you have a bird or a gerbil, when you pet those animals and you talk to them, it increases the social connection that we have. And even, patients in hospital, I've worked for many, many years with senior centers, with seniors in assisted living and nursing homes, skilled nursing, and it brings back so many memories. In fact, I can recall an instance where there was an individual that was nonverbal, and she started talking.
When the dog was in the room? When
the dog was in the room, and it's really powerful. So to be able to, interact with the animals, I mean, really, would you rather see a clinician come in a white coat, or would you rather have a dog prancing into your room?
That's a rhetorical question,
yes.
I think. But Gayle, how about how did you get interested in this, and to the point where you decided, when you actually got Timbo, that you were going to turn Timbo into a pet therapy dog?
Well, the truth of the matter is, 4 years ago, a family member that I love very much and my family loved very much passed. And I was in a really dark place. And when I got Timbo, immediately there was some light brought back into my soul, my heart. So I knew that was our purpose. And that was the goal every day up to today and going in the future. So I knew that that's what I wanted to do with him.
We only have less than 3 minutes left, but I do want to get, can anybody do this? How do you get into it? Something about training. So let's say somebody's sitting at home, they've got a pet who's wonderful. What are the steps?
I would say the first step is connecting with your local trainer to obtain a Canine Good Citizen certificate.
Everybody knows what that is?
Most pet owners will know what that is, a Canine Good Citizen test.
Yes. So, for example, here in Norwalk, there's an organization called Doggone Smart. And you go to Doggone Smart, you can enroll in the class, and the class, as Gayle mentioned, is usually a few weeks, and they will observe the relationship.
The class for the owner and the pet?
Oh, absolutely.
So you do this together?
It's always for the owner and the pet.
And there's usually not more than 15 students or teams
How
in a
did
class.
Timbo react to being in the class with you?
We were in a class of 11 dogs and 11 handlers, and it was very clear from the Good Dog Foundation trainer that this was not playtime, so that in itself was an obedience command. Timbo was great. I mean, we were sitting closer than you and I with 11 other dogs in a circle. So behavior was really important at that point, because they do. The trainer observes the dog's behavior and my behavior.
Was this? Again, we're running out of time. But was this done specifically to become a pet therapist, or was this just to get the good canine certificate?
So that's the very first step in the process. However, when you align with one of the national organizations, and there are several, you can do your research. And we work closely with Good Dog Foundation. We also work with Pet Partners and Therapy Dogs International. So there are several national and local organizations that you can align with.
Again, I'm sorry for the time pressure, but somebody wants to bring their pet into this. They go through the pet citizenship course. Do they call the hospital? Do they ask for the head of pet therapy? Where do they go next? The volunteer office? So
that's an excellent question. I'm glad you asked. Thank you. They reach out to volunteer services. They can email us at volunteer@newvancehealth.org.
Okay.
They can visit our website, and feel free to contact me or any of our managers of volunteer services throughout the network, where you can learn more about.
And is there more training after that, Gayle? You've going from this.
You have to be recertified every year. So how Timbo and I started, we had to fill out a pre-screening form. After that, we were called for a one-on-one evaluation where the evaluator observes Timbo's temperament.
That's all we have time for. I want to thank Gayle, Timbo, and Amy for joining us on Health Talk today. Thank you for watching. It's a great topic. We want to hear from you, so please share your comments and questions with us, or if you have questions about pet therapy, you can email us also at healthtalk@newvancehealth.org. We'll see you next time on Health Talk. Bye-bye.
145 over 92.
180 over 111.
182 over 100. And I had a heart attack and a cardiac arrest, and then a stroke.
Your blood pressure numbers could change your life.
A lot of people don't understand, including myself. I didn't, now I do, the impact of having a stroke.
My memory is shot.
When I woke up, I couldn't speak.
If I would have followed a treatment plan, I would not be in this situation.
It's a tough journey.
Lowering your high blood pressure could save you from a heart attack or stroke. If you've stopped your treatment plan, restart it or talk to your doctor about creating one that works better for you. Start taking the right steps at manageyourbp.org.
It's a new life, but I'm gonna make it better. Coming back. Ask your doctor, check your blood pressure.
Volunteering at your hospital is not just for people. At New Vance Health, some volunteers are furry and have 4 legs and a tail. On this week's Health Talk, we'll discuss how pet therapy volunteers make a real difference for patients and staff. Our guests are Gayle McGrath. She's assistant to the president of Norwalk Hospital, and her pet therapy dog, Timbo, and Amy Lionheart, manager of volunteer services and a member of the patient experience team at New Vance Health. Stay tuned for a fun Health Talk. We're up next. Hello, I'm Dr. Eric Mazer. On this week's Health Talk, we're discussing pet therapy and volunteering. Our guests are Gayle McGrath, assistant to the president of Norwalk Hospital, her pet therapy dog Timbo, and Amy Lionheart, manager of volunteer services and a member of the patient experience team at New Vance Health. Welcome to Health Talk, ladies.
Well, thank you.
Thank you.
Glad to be here.
This is such an uplifting. In medicine, we're often talking about sad things, or this is such an uplifting story, both volunteering and specifically volunteering with a pet and the role that they. Maybe we can say just a general few words about volunteering first, because when I was here at Norwalk Hospital, many of our viewers probably know I was here for over 20 years. Volunteering was a big part of the hospital. They played a real central role in giving kids tours of the pediatric unit and just keeping the staff and people happy.
Well, now I may be a little biased, but I feel volunteers are the heartbeat of this organization. Volunteers give so much to New Vance Health. They really come to us with so much expertise. There are volunteers that are just getting started out at high school and college level, and there are those volunteers that come to us as retirees.
And I'm going to say, as a recent retiree, part of being retired is finding meaning in your life as a retiree. And I know a lot of people volunteer at hospitals at that stage of their life, particularly people who have been in executive positions and business positions and really want to somehow get into a touchy-feely human interaction is what they do. So it's very something. It's a solution to many people's conundrum of this time of life.
Absolutely. We have volunteers that come to us that are skills-based volunteers working in virtually every department within our organization. And they really bring a lot to the table.
And you can either work with patients or even without patients. My mother volunteered here at the end of her life and was too saddened by working with patients, but she worked behind the scenes and was able to volunteer and help.
You know, when you talk about patient experience, hospitals often struggle with, striving to achieve the ultimate satisfaction when it comes to patients, and volunteers help to bring that aspect to the organization. They whether they're 4-legged furry animals or individuals that are coming in as a retiree, they bring a face to the organization and really bring that social connection.
And they often have time to interact with patients, help them navigate areas that getting a drink, getting something from the cafeteria.
It's invaluable.
Getting in touch with somebody. It's, as you said, these are all important part of living, where many of the professionals, and I'll blame myself as well, are so busy you don't have time to do that.
And you know what? Sometimes there's a lot of fear and mistrust when people come into a place where, you know, they may not be familiar, they may be dealing with a life-changing diagnosis, and they're fearful. But when a volunteer walks into the room, they're often more open to tell that volunteer something and open up to them rather than telling a clinician.
That's absolutely true. And the volunteer shouldn't be frightened, because just being a human being is what they need to be, and we'll teach them the things that they need otherwise to help. Now, Gayle, you are a volunteer as well as a long-term employee.
Yes, so I have the fortune.
Why did you volunteer?
Well,
didn't you get enough of this place
no,
from 9 to 5 or 8 to 6?
I am very fortunate, number one.
I'm just kidding. Gayle, I've known Gayle for so many years.
That I love my role at the hospital, being the assistant to the president. But how fortunate am I to share Timbo with the staff and the patients? And as I said earlier, their experience is in real time for me. I see the joy. I see.
You get immediate feedback.
I get immediate feedback, and there's conversation that's about Timbo, nothing else.
Isn't it interesting the way a dog in the room changes everything?
It does change everything, and again, it's in real time. You see it right at that moment.
The psychological effects of petting a dog, or even simply seeing a dog, I mean, it's really life-changing, and really helps to bring people out of their shell.
Do you have any specific instances where you remember, or the experience you've had with patients with Timbo that stand out in your mind?
Well, the patient we had at the cardiac lab, I didn't know there was a patient in the cardiac lab. You know, we always ask if we can visit. That's very important to be courteous as a handler, because not everybody wants a visit. And the cardiac staff asked us if we would pay a visit to a patient. The minute we brought Timbo in, the feeling of love.
Instantaneous.
It was instantaneous.
Now, this
No
patient was getting a
judgment.
procedure in the laboratory? Is that?
No, she was, I think, it was in a room. It wasn't a procedure.
No.
But she was frightened and.
Well, she wasn't frightened. I mean, when I brought Timbo in, she was with staff, and it was just instantaneous. The emotion of just seeing Timbo, it was very positive.
Yeah, and if there was any cortisol levels, they went straight down when he came in.
Totally.
Well, it
Totally
is. The hospitals are intimidating places, and they're scary. And I know, even as a physician, when I've lived in hospitals my whole career, as a patient, it's uncomfortable. You give up a lot of power. You don't know what's going to happen to you. You're worried about results. You're thinking of it, and to bring such a wonderful piece of humanity or non-humanity into the room and bring out that's such a wonderful thing to do.
Timbo does a great job. He likes the interaction. You know, he's very devoted. He's eager to learn. He's enthusiastic. He has so many good characteristics.
Not all dogs can be pet therapy or animal interaction dogs, can they?
No. There are some breeds that I would not recommend as an animal-assisted activities or pet therapy animal, but there are those whose temperament is really, you know, kind of mellow, and in fact, I have a dog that used to come with me to work every day for 12 years when I was working in a nursing home. And he's a rat terrier. He's about 19 pounds. Normally, rat terriers are quite rambunctious, but he was the runt of the litter, and he was trained here in Norwalk, and he actually became a pet therapy dog.
The ugly swan. He became the swan of the litter.
He sure did, and now he's retired. But when I tell you the smiles, you know, the happiness that he brought to those individuals, I see it every day, and so we're really looking for more animals.
So the dogs enjoy it too. How does Timbo? Does Timbo know that he's going out when you put on his kerchief?
He knows. He does know. Like, he knew today when I left the house that he was coming with me to the hospital. the way he spins his body around. There's an excitement about it, and he's just great. He likes to do it. It's very important that you need to know about your dog that they want to do this type of work. And Timbo likes to do it. He likes to.
So he doesn't mind strangers, because you're bringing them into strange people in a strange environment, really.
He likes the interaction.
And we always want to make sure that the animals are comfortable with the situation, because they are highly sensitive beings. And usually if you bring a dog into a room where someone is feeling pain, they will sense that pain.
Really?
So we have to be very careful with the dogs that come in, and only have them come in for a limited amount of time. So they're with us for an hour, and once that hour has passed, they're usually pretty drained, and they're exhausted.
They are.
It takes a toll on them.
It does take a toll. I can tell when Timbo is tired.
Wow.
Not like this, but.
Let me ask a question. It may sound a little silly, but I could see people asking this at home. The infectious issues, the hygienics of bringing a dog into a hospital. I know the answer to this, but we don't bring dogs into restaurants generally. You wouldn't bring a dog into an OR. Are there any infection control issues that patients have to worry about if a dog is in their room?
Well, that is an excellent question. We take a lot of care into prepping the dogs that come to us. They have a bath before every visit, so Timbo is nice and clean. When you touch him, we also use sanitizing wipes, both before and after an individual has an encounter with an animal. So we want to make sure that we're protecting not only the patients and the staff, but the animals as well.
Sounds like he's cleaner than Uncle Fred. When Uncle Fred comes to visit.
Yes.
I doubt Uncle Fred goes through that sanitizer. Well, so there really, I know that there really is not a concern. So you pay those, you take care of those things that you can do.
Absolutely.
But it's not like they're spreading disease. And in fact, the worst, I can say this as a doctor, the most dangerous spreaders of disease to human beings are other human beings, because we carry around the germs that infect us.
And not only that, but studies have shown that dogs who have gone into ICUs have really increased the positive outcomes for those patients. So it's not only, the family members, the caregivers that need support, the patients as well. And so when dogs have gone into ICU, I tell you, it really is tremendous to see the reaction.
There is a vast and accumulating body of information about the psychiatric effects of an ICU stay on a patient, and they are quite profound. So that's really, I didn't know that. That's wonderful news to hear, because you get the person through COVID for today's sake,
Absolutely.
and you get them out, but the ICU experience is a trauma that is equivalent to a war trauma. And a lot of people come out of it with a lot of damage.
I think simply put, it's just not a physical connection. I think it's even emotional connection, and I think that's where the benefits come for the patients and the staff, because they're feeling stress, but when they see Timbo, the stress sort of fades for that moment of time.
Even family members, I would suspect, bring stress into the room with the patient, whereas the dog, a pet like this brings nothing but love.
Yeah, that's all it is. It's unconditional love, and just by being himself.
Yeah, there's no judgment,
No judgment.
It's absolutely,
remarkable
Timbo is
relationship
being Timbo.
It's a remarkable relationship we have with animals and pets, and it's thrilling, frankly, to hear how we're using them to enhance our medical care. We've run out of time, but sorry. That's all we have time for today. Thank you again, Gayle and Timbo and Amy, for joining us on Health Talk, and thank you for watching. And from home, you can share your concerns, questions with us by emailing us at healthtalk@advancedhealth.org. We'd love to hear from you. We'll see you next time on Health Talk.